Bismillahirrahmanirrahim. This is the fourth lecture of breast cancer. I will follow now treatment or management of breast cancer. I will begin with radiation oncology. Radiation therapy has a significant role in local disease control. The risk of cancer recurrence decreases by about 50% at 10 years, and the risk of breast cancer death reduces by almost 20% at 15 years when radiation therapy follows breast cancer surgery. However, radiation is not necessary for women 70 years of age and older with a small tumor, lymph nodes negative, hormone receptor positive cancers, because it hasn't been shown to improve survival in patients who take hormonal therapy for at least 5 years. We are seeing here case of intraoperative radiation therapy for breast cancer. And we are seeing here breast conserving surgery, for example, lumpectomy, and here removal of lymph nodes, and here lumpectomy for small breast cancer. Radiation therapy is beneficial in large tumors greater than 5 centimeters, or if the tumor invades the skin or chest wall, and if there are positive lymph nodes. In this slide, we are seeing here case of intraoperative radiation therapy procedure in 4 steps. The first step is tumor removed. The second step is balloon applicator placed into the cavity. The third step is radiation treatment delivered in as little as 8 minutes. The fourth step is balloon removed and the cavity is closed. Radiation therapy can also be used as palliative therapy in advanced cases, such as a central nervous system or bone metastasis. Radiation therapy can be delivered as external beam radiation, brachytherapy, or a combination of both. We are seeing here case of radiation therapy prior to surgery secondary tumor risk in early stage breast cancer patient. And we are seeing here case of brachytherapy. I will talk now about medical oncology. This consists of chemotherapy, hormone therapy, and targeted therapy are the systemic therapies used in breast cancer management. a 25% reduction in the risk of relapse over a 10 to 15 years period using a first generation chemotherapy regimens such as cyclophosphamide, methotrexate, and 5-fluorouracil in a 6-month cycle. Anthracyclines, for example, doxorubicin, ibuprofen, and the newer agents such as the taxanes, are modern regimens used for breast cancer. Between 3 to 6 months period is used for adjuvant and neoadjuvant chemotherapy. Adjuvant treatment of early stage hormone receptor positive breast cancer with tamoxifen for at least 5 years has been shown to reduce the recurrence rate by about half throughout the first 10 years and reduce breast cancer mortality by about 30% throughout the first 15 years. More recently, studies have shown that extended use of adjuvant tamoxifen 10 years versus 5 years further reduces the risk of breast cancer recurrence and mortality. So clinical practice guidelines now recommend consideration of adjuvant tamoxifen therapy for 10 years. The mainstay of treatment for most premenopausal women with hormone receptor positive tumors is tamoxifen. Some women may also benefit from surgical removal of the ovaries, this operation called oophorectomy, or chemical suppression of the ovaries, which are the main source of estrogen before menopause. Treatment guidelines recommend aromatase inhibitors such as anastrozole should usually be included in the treatment of postmenopausal women with hormone receptor positive breast cancer. I will talk now about targeted therapies usually indicated in about 17% of breast cancers that overproduce the growth promoting protein HER2/neu. Trastuzumab drug, the first approved drug, is a monoclonal antibody that directly targets the HER2 protein. Trastuzumab reduces the risk of recurrence and death by 52% and 33% respectively if combined with chemotherapy in HER2 positive early breast cancer if compared to chemotherapy alone. I will talk now about a prognosis of a breast cancer. We are seeing here in this slide 5-year breast cancer survival rate. For stage 0, the survival rate for 5 years close to 100%. For stage 1 of a breast cancer, the survival rate for 5 years is 98%. The survival rate for stage 2 for 5 years is 93%. The survival rate for 5 years for stage 3 is 72%. The survival rate for 5 years of stage 4 of a breast cancer is 22%. When the disease spreads systemically, its prognosis worsens dramatically. Only 22% of stage 4 breast cancer patients will survive their next 5 years. I will talk now about complications of breast cancer. Complications can arise from the treatment, whether chemotherapy, radiation therapy, hormonal therapy, or surgical therapy. Complications post-surgical therapy of breast cancer include, for example, in this slide, pain is 7.32%, tissue necrosis is 17.07%, wound dehiscence is 31.71%, seroma is 26.82%, altered sensation is 21.95%, hematoma is 7.32%, lymphedema 0%. I will talk now about complications post-chemotherapy for breast cancer. We are seeing here in this slide, for example, hair loss, mouth sores, nausea and vomiting, constipation and diarrhea, neuropathy, rashes, bruising or bleeding, weakened immune system, trouble breathing, pain or headaches. I will talk now about complications accompanying hormonal therapy for breast cancer. Headaches, which is very severe and sometimes pulsating, irritation of skin, monthly bleeding in women who have reached menopause, breast tenderness, skin discoloration causing brown or black spots, irregular spotting, increased breast density. I will talk now about complications post radiation therapy for breast cancer. We are seeing here in this slide many complications, for example, fatigue, skin color changes, swollen lymph nodes, breast pain, increased density of the breast, flaking and peeling, dryness, swelling, shrinkage, armpit hair loss, weakness, numbness, difficulty swallowing, sore throat, nerve damage. In the end of this lecture, thank you for all.